A recent law signed by Idaho Governor Brad Little has sparked significant debate across the nation. This law, set to take effect on July 1, 2025, ends publicly funded vaccinations for immigrants in the U.S. illegally. This move aligns with a broader Republican-led effort to support President Trump's immigration policies. The law also restricts other public benefits, emphasizing the need to prioritize state funding for emergency services. This law has raised concerns about its impact on immigrant communities and healthcare providers in Idaho. The implications of this new law are far-reaching and not without controversy. This law doesn't just end publicly funded vaccinations for immigrants in the U.S. illegally, it also curtails other public benefits. These include communicable disease testing, prenatal care, crisis counseling, and even some food assistance for children. The ripple effect of this law extends beyond just the immigrant population. It also impacts the healthcare providers who serve these communities, adding another layer of complexity to an already intricate issue. The law has been met with opposition from various industry and religious groups, arguing that limiting preventative healthcare could harm public health. But there's also support for the law, notably from the Idaho Freedom Foundation, which emphasizes the need to prioritize state funding for emergency services. While emergency medical services remain available regardless of legal residency, the new law may deter lawfully present immigrants from seeking health services. This potential chilling effect is part of the broader debate surrounding this law and its implications for both public health and immigration policy. The debate surrounding this law is heated and multifaceted. On one hand, opponents argue that limiting preventative healthcare, such as vaccinations, could pose a threat to public health. They worry about the potential for disease outbreaks and the strain this could place on our healthcare system. On the other hand, supporters of the law emphasize the need to prioritize state funding for emergency services. They argue that public resources should be reserved for those legally residing in the state. As the law takes effect in July, its actual impact on public health and state funding remains to be seen. Join our community of informed citizens. Subscribe to your daily dose of news and be part of the conversation.